Greetings, everyone. My name is Nidhi Thakur, mother, a daughter, and a wife, a cinephile, a science enthusiast who loves to cook and travel. My professional title is Lead One Health Mission Program Management Unit, and I currently work at the Office of the Principal Scientific Advisor to the Government of India. The project that I chose to do in this WomenLift health journey is focused on understanding the leadership characteristics, responsibilities, motivations, and barriers that women leaders face during public health emergencies. During a public health emergency, effective leadership and response to threats are critical. Women leaders and professionals around the world are developing ways to foster strong, confident, authentic, and effective leadership. However, there are several challenges that they face on personal and professional levels. The strategies and their effectiveness are also influenced by the specific contexts in which they are enacted. This project delves into qualitative analysis of decision making by women in leadership position, aiming to uncover their personal experiences and values that shape choices during a crisis situation. The findings of this project might help to create a resource for emerging women leaders to get a perspective of crisis leadership characteristics and behaviors that help design best practices for training and nurturing women leaders. The leadership project set out with an analysis of crisis leadership competencies through desk research. Existing literature in this domain pointed to characteristics that could be broadly categorized into individual competencies or task management, people and ecosystem management, and adaptive competencies. Taking into account the contextual enablers and barriers such as organizational, cultural, and political, a questionnaire was designed with a strong gender lens to understand the career path, characteristics, and challenges that are displayed by women leaders. Senior women in leadership positions from different agencies involved in the health sector, such as administrators, researchers, entrepreneurs, veterinarians, funders, and communicators, were identified for conducting the interviews. The leadership attributes that this journey entails authentic, inclusive, strategic, and impactful were foundational for designing the questionnaire for this study. Following were some areas of the questionnaire stemming from the four pillars of the leadership journey. To understand authentic leadership, I delved into idea of leadership and leadership style, strategies to build resilience, and gender-based experience in professional settings. For inclusivity, I focused on aspects like importance of gender equity in leadership roles and its impact, managing ethical considerations and ensuring clear communication with different stakeholders. Strategic aspect was figured in with insights on stakeholder management in diverse settings, decision-making process during the emergency, and the impactfulness was stressed by team building and the importance of feedback, developing crisis leadership skills in young women managers, and developing an enabling environment for the team to flourish and learn. The early insights of the project emphasize on the importance of characteristics that are displayed on the screen. These characteristics were, of course, ranked differently by the respondents owing to their different roles. It was highlighted that in crisis situation, the response manifests very differently owing to the social, cultural, organizational, and political context. The importance of communication, feedback loops from subordinate, and other stakeholders emerged as a crucial aspect for handling emergency situations. The interviews also highlighted that gender has impacted the career experience and opportunities of the respondents in general. In response to the recommendation for improving women participation in senior roles in the health systems, all respondents highlighted the importance of networking in membership and mentorship. The respondents underscored that building crisis leadership competencies encompasses not just capabilities in motivating people and enabling task completion, but also in adaptive capabilities like the ability to have a systems perspective, making sense in a particular context and clear communications. Investing time in routine preparation and planning and collaboration was deemed critical for designing a strategic and robust response when emergencies strike. Practicing pressure handling techniques, which build resilience, was also critical for crisis leadership. To keep this discourse going, the project aims to continue and seek insights from women in leadership positions to inform the best practices for training and nurturing upcoming women leaders. The study can be extended to develop an interview instrument for women leaders to catalog their journeys during health emergencies. That is all from my side. A big thanks to the Women Lift Health team and a shout out to all my cohort members for being such a sport. Thank you.